Hi, I'm Rosario. And what I'm about to show you is not another medical image classifier. It's something different. It's called OtoChronicle AI, a longitudinal clinical intelligence platform built for ENT specialists. Today, when an ENT examines a patient with recurring tympanic membrane issues, the analysis is almost always point in time. You look at today's image and form an opinion. But the real clinical truth of the eardrum doesn't live in a single picture. It lives across time. It lives in the question every doctor actually asks themselves. How is this membrane evolving compared to 3 months ago? Is it improving, worsening, or fluctuating? And that's exactly the question current medical AI systems don't answer. OtoChronicle AI flips the perspective. We don't ask, what disease is in this image? We ask, how is the tympanic membrane evolving over time? Temporal continuity is the intelligent core of the system. And this is fundamental. The physician always remains the final clinical authority. The AI proposes, the doctor decides. Technically, OtoChronicle is a cloud-native system built on 3 pillars. First, a Flutter web frontend that gives the physician an interactive patient timeline, TS chart, clinical validation, and visit history. Second, an ASP.NET Core 9 backend deployed on Google Cloud Run. This is the source of truth. It manages patients, exams, persistence, JWT authentication, image storage on Google Cloud Storage, and the entire physician validation workflow. Third, and this is where the AI lives, a Python agentic runtime built on Google ADK and Vertex AI with multimodal Gemini, also running on Cloud Run. It's an asynchronous multi-agent orchestration where every agent has a precise responsibility. There are exactly 3 agents and they execute in a sequential pipeline. Agent 1, the acquisition intelligence agent. It doesn't diagnose anything. Its only job is to make sure the otoscopic image is comparable to the previous ones. Focus, exposure, framing, anatomical angle. Because without reliable acquisition, there is no reliable longitudinal reasoning. Agent 2, the temporal clinical reasoning agent. This is the longitudinal brain. It compares the current image against the patient's entire history, previous images, physician validations, reports, audiometries, and produces a TS Tympanic Evolution Score from 0 to 100, a temporal severity indicator, not a diagnosis, an evolution state, stable, improving, worsening, fluctuating, or uncertain, a clinical sentiment and a progression velocity, and most importantly explainable observations, increased opacity, progressive retraction, vascular congestion, membrane thickening. The doctor sees why the model changed its mind. Agent 3, the clinical validation and trust agent. It estimates how much we can trust the output, temporal coherence, historical AI-human agreement, confidence instability, and it recommends when a case needs prioritized human review. Let me be crystal clear here. OtoChronicle AI does not replace the physician. It amplifies them. Every AI output is preliminary. The physician can validate, modify, reject, or annotate it. And the system preserves everything: the original AI output, the physician's correction, the full history of disagreements. This builds a complete clinical audit trail, and, over time, a human-validated ground truth dataset. Here's a real demo patient. Show patient list, I open their chart. This is the TS timeline. Each dot is a visit, the x-axis is day, month, and year. At a glance, you can see the longitudinal evolution of the condition. I upload a new visit, 2 otoscopic images, right ear and left ear. Show upload. The images go straight to Google Cloud Storage through signed URLs. No base 64 payloads, everything enterprise grade. The backend triggers the asynchronous workflow, the ADK runtime orchestrates the 3 agents, and within seconds I get an AI preliminary assessment, suggested TS, trend, clinical summary, confidence level, and the acquisition quality warnings. Now the physician steps in, I can adjust the TS, write the correction reason, and the system records both the AI value and the final value. The chart updates in real time. OtoChronicle AI was born from a simple idea. Medicine is a story that unfolds over time, and AI must learn to read that story, not judge isolated frames. Our goal is not to automate the physician. It is to give them a longitudinal co-pilot that sees patterns the human eye can miss between visits months apart. Thank you for watching. OtoChronicle AI, the tympanic membrane told over time.